Hi, everyone. My name is Dr. Orlando Harris. I'm an associate professor of nursing and medicine here at the University of California, San Francisco, and one of the co-directors of the California Center for HIV Syndemic Policy Research. I think one of the reasons why this research is so important to me on a personal level is that as a clinician, you see people that come into your clinic and you might label them as high risk, right? And so it makes me question, and this is what led me to conduct this research really, because it made me think through, is loneliness a symptom or a disease? We recognize that loneliness is really a symptom. It's a symptom of a larger societal structural problem. For example, Black gay men, Latino gay men might go into, say, for example, a predominantly gay spaces like the Castro in San Francisco or Christopher Street or the Village in New York City. And as a Black gay man, you might feel lonely and isolated because you're not often welcomed in predominantly white queer spaces. And then as a Black gay man living with HIV, you might not, as a Black man, Black gay man, you might not be welcomed in majority Black spaces because you're gay. And then if you compound that with being Black, gay, and living with HIV, then you might not find any sense of community at all. And that drives loneliness and isolation. And as a clinician, and on a personal level, I've seen too many people who experience these things. And immediately when they go see a provider, the provider's first instinct is to prescribe some sort of antidepressant to treat what I would consider all the effects that are societal, that are more structural, right? And instead treat the individual thing. Well, you're experiencing depression, you're experiencing loneliness. And so not loneliness, rather, you're experiencing depression or anxiety or other mental health issues, so let's treat that. And what I'm saying, and from this work, is that if we treat the structural things that are causing the loneliness to begin with, there may not be a need for antidepressants or other psychotropic medications.